convention together was stressful and caused a little bit of anxiety for some of the planners. So some of the symptoms include excess worry, irritability. You might notice some muscle tension in your body, difficulty sleeping if you're overthinking about what you're stressed about. You might feel your heart start to race, and you might feel that it's hard to focus and think about the things that you're working on. And anxiety is a fear-based emotion. So back in caveman era, anxiety is what kept us alive when bears were chasing us. So anxiety causes our heart to race, it gets blood and energy to all of our muscles, it makes us focus, hyper-focus on the thing that we are afraid of. We can't think about anything else except for the bear that's chasing us. And that kept us alive. For generations, that is how we have come here to this stage. But today, typically, we don't get chased by bears. But even with the things that are not going to physically threaten us, our body reacts in the same way. So that exam that you were scared about, your body feels like you're being chased by a bear. Your heart is racing, you can't think about anything else except for that exam. Maybe you can't sleep, maybe you are worrying about this all the time. So even though everyone has likely experienced this in small ways every day, it can be a clinical issue if the excess worry and ruminating is disproportional to the consequences. So for example, in my practice, I focus on treating a lot of folks with anxiety. So there might be someone who comes in who has very severe social anxiety, so someone who's afraid of interacting with people around them. Now, everyone gets a little bit nervous talking to people sometimes, but a clinical diagnosis of social anxiety might be someone who is so afraid to talking to someone that they don't go to the grocery store. Now, that is something that impacts their daily functioning. If you can't go to the grocery store and buy foods, you're not eating, you're not having your daily needs met. And so we have different ways that we work on to help someone get over their fears of interacting with people, fears of going to the grocery store. There's also other anxiety-related conditions, so these are other diagnoses that are based off of fear. So OCD is a common one people might have heard of. It's based on certain fears that cause anxiety, and then as a result cause different compulsions that can be very disruptive to day-to-day life. PTSD can cause a similar anxiety-based reaction that I talked about, racing heart rate, fatigue, but it comes from a traumatic experience that someone might have had. Talked about social anxiety a little bit. Performance anxiety is very similar to that as well. It's based off of the fear of judgment, fear of interacting with people. So that's a snapshot about anxiety. If you guys have more questions about that, we can answer later. Another one that I wanted to touch on is thoughts of suicide. This one's a tough one. People don't like talking about it. People don't want to think that the person sitting next to you might be having thoughts of suicide. People don't tell other people if they're having thoughts of suicide sometimes. And so I wanted to go over signs that someone might be considering suicide, just so that you all have the tools to help your community and the people around you. So some of the symptoms are extreme hopelessness or feelings of being trapped. This might be someone who says, I would rather end my life because there's no other options left for me. There's nothing else there for me. Someone might start to kind of randomly and suddenly start giving away their belongings as if they're preparing for their death. They might kind of randomly out of the blue be visiting all of their people, saying their goodbyes without directly saying, I want to end my life. Now, there's a lot of confusion sometimes about how to talk about suicide and how to help someone. Some people believe a common myth is that you should never say the word, you should never ask someone if they're thinking about it because that might plant the seed in their head. This is actually wrong. It is very important if you think that someone might be considering it to ask directly. Ask them directly, are you thinking of harming yourself? Are you thinking of ending your life? And then collect some information. For some people, it is a spectrum. So some people might be at the very beginning of that spectrum where they have thoughts like, I don't want to be alive right now, but I don't think I'm going to actually do anything about it. So ask about, do you have a plan? Do you know how you might end your life? Someone might say, actually, I want to end my life and I have a bottle of pills and I want to overdose. Now you know what their plan is. You can try to take that plan away. Means restriction is the most effective way of saving a life. And so someone says, I plan on overdosing, you can say, okay, give me your bottle of pills. I'm going to hold on to this until you feel better. One resource that you can look into is the Columbia Suicide Severity Rating Scale. It's a very easy to use way to assess for thoughts of suicide and assess for how severe someone's thoughts might be. Ways to get help. One of the best ways is to go to your nearest ER or urgent care. They will have medical and psychiatric professionals to help regardless of what stage of suicide thought someone's experiencing. You can call 988, which is a crisis hotline. You can text the crisis text line as well. The number is up on the board to reach out for help. Some of the common red flag statements that can be helpful to be aware of to pick up on whether or not someone is experiencing these thoughts are listed over here. So some people might say, I want to go to sleep and never wake up. This is someone who's feeling very trapped and very hopeless and does not want to live through whatever they're experiencing. Someone might say, nothing matters anymore. Everything is hopeless. I don't care anymore. That's another sign of that hopelessness, feeling trapped. I feel trapped, I'm a burden. Again, these are all very common signs. So if you hear people saying things like this, ask directly, ask what their plan is, ask if they have any ideas of what they might do, and you could save a life.
My practice and what I'm working on specializing in. So I work as a clinical therapist at Wayne Health Psychiatry. I recently graduated, so I'm currently practicing with my limited license and working towards full licensure. I currently work in Detroit, so a very urban population. I work with adults, a lot of low-income, low-resource communities, so people experiencing anxiety and depression because they don't know what their next meal is going to be. People worried about not being able to afford rent, among all the other kind of commonly known mental health conditions. Currently working on specializing in anxiety, OCD, and PTSD. Work a lot with fear-based disorders. I've also worked with grief, schizophrenia, and have also done a little bit of couples and family counseling as well. What I do is I do behavior therapy to help manage the symptoms of mental health disorders. So in the example of social anxiety, someone comes and says, I absolutely can't go to the grocery store because my heart is racing and I'm very afraid. So we talk about ways to reduce those symptoms, manage those symptoms so that they can go back and go to the grocery store and buy the food that they want. I do collaborate very closely with psychiatrists, case managers, psychologists, nurse practitioners to make sure that we're providing holistic care. So as a social worker, as a therapist, I cannot prescribe medications, but sometimes antidepressants can be a very powerful tool in reducing depression and getting that to a baseline level where therapy becomes a lot more effective. So it's great that we can collaborate there. And I just help manage stressors. So as I said, some things are genetic. You might have a predisposition for ADHD, we manage those symptoms. You have a predisposition for depression, we manage those symptoms. But sometimes stressors are very external. Someone might be going through a very difficult relationship situation that's causing depression or anxiety. We talk about how do you manage that? What are conversations that you can have with a partner, a parent, to manage these stressors in your life and reduce that anxiety. Work on finding resources for finances, study tools to improve academic stress, really anything that someone needs in order to feel well and succeed in whatever their goals are. I also wanted to share a little bit about mental health fields. There are many ways that people can get involved and many ways that mental health looks like. So people can get a master's in social work like I did, or a master's in counseling psychology. Some folks also get a PhD in clinical psychology or counseling psychology. And then of course there's the medical route, medical doctors, DOs, who specialize in psychiatry or primary care can also provide services. This distinction is also important for those seeking care. So if someone is experiencing difficulties in their mental health and they are interested in getting a prescription for an SSRI, the person to go to is a psychiatrist. They will talk to you for a couple of minutes, understand your medical history, and prescribe the appropriate drug and dosage for you to feel better. In addition to that, therapy is administered by a therapist like myself, a social worker, or a psychologist that works in collaboration with the psychiatrist to work out the behavioral, mental, and cognitive aspects. So if you have any questions about what I do, my specialty, or if you're interested in seeking care yourself but don't know where to start, I can provide any sort of help and support with that. Oh, and here are also some resources. So one book that I recommend, particularly to all children of immigrants, but in addition to immigrants themselves, is a book called But What Will People Say by Sahaj Toli. She is a South Asian therapist herself who has also been through a lot of mental health challenges, including anxiety, thoughts of suicide, and more. And so that's a fantastic book about how to navigate the intersection between being in America and American culture, along with our expectations, responsibilities, and just values and morals of the South Asian community. Crazy Like Us by Ethan Waters is another book that's fantastic. They talk about how mental health looks different in different cultures. So within the South Asian community, what feels like anxiety to us might be a little bit different from what anxiety looks like in the white American population versus the Hispanic population. And then increasingly, mental health is talked about in pop culture and media. So Never Have I Ever is a very popular Netflix show, for example, and Man Mukti has discussion boards and podcasts that also talk a lot about mental health, pushing us towards destigmatization. Here are some resources on finding a therapist and finding care. This is, to find a therapist, you can look into the South Asian Mental Health Network. You can find providers that are directly within the South Asian community. You can also find support groups where you can talk to other people going through similar experiences. You can talk to your family and friends who are, who you trust and who might be able to point you in the right direction. And if you're not ready to see a therapist yet, or if you're not ready to talk to essentially a stranger about your problems, there are also anonymous call lines where you don't have to reveal your identity and who you are in order to receive help.